All right, so I'm calling this meeting of the Board of Health to order. This notice was posted on January 18th, 2022, 3:25 p.m. So we're within the parameters of that. We don't have any minutes from the last meeting to approve, so we'll get by that. So I guess the next thing we do is COVID
updates.
Yes.
Okay, so I can tell you that and keep in mind, I ran numbers a little earlier than usual. I usually run them somewhere around between 9 and 10 at night. Our total numbers are 334 cases. That's a difference from last week, which was 428 cases. But again, keep in mind, I ran them much earlier than usual. And this does not take into account home testing, which a lot of people are doing home testing at that point. So there is, and I think I've explained that to you guys before, we cannot, we don't document, there's nothing that we can do as far as documenting home testing. So therefore it does not go into our database. You know, we do get phone calls and we certainly take phone calls, but DPH has told us not to do any kind of recording or documenting as far as that goes. The breakdown, so they started a new report that we can do, and the two different reports are, we can do 18 or older. So there were 248 cases in that age range. So from 18 years and older, 248 cases. And then less than 18 years old, there was a count of 86 cases. And then I further was able to break that down. Out of that 86, 25 are kids under 5 years old. So that's the total of the 334 cases that are actually in my database. As far as the vaccination rates, we're holding pretty steady for all residents. We're right at 76%. That hasn't really changed over the last month or week or so, couple of weeks. The 51 to 65 hasn't changed, 41 to 50. The one that did change, though, was the 23 to 40-year-olds. We are at 75% for that. And then the other one that changed was the 5 to 11-year-olds, and we are up to 41% for a vaccination rate for them. Yes, Aaron?
Thank you, Ms. Ryan. The state's vaccination numbers that they publish on their website are slightly different than yours. Do you have any? I'm wondering why those don't match up perfectly. And I know earlier in this, there was a kind of your Maven set of numbers, and then there was the scrubbed numbers that the state puts out. I'd like to compare notes with you. Maybe tonight's not the night, but we should talk about.
That's fine. And I can give you just the reason. One of the reasons is because there's a lag time. There's a couple of things that come into consideration. There sometimes the numbers can be different because there's a deduplication process that needs to take place. So, you know, a person might be in as Judith M. Ryan versus I could be also in as Judith Ryan without the M.
Not Judy Ryan.
Not Judy Ryan, no. So that would have to be deduped. There's a deduplication process. And the other thing is that there might be a lag time between when they go into, so if I put it in, if I gave a vaccine, it's going to immediately go into my database. Whereas if CVS gave it, it might not go right into that database. So there's the difference.
And there is some categories, particularly the older buckets, where their numbers are adding up to over 100%. So it does seem like there's a data cleanliness issue where it's probably a booster shot getting recorded as a second shot. That's really their third shot.
Yeah.
But so I've noticed that it doesn't always add up, but I just wanted to maybe offline touch base with you on what we're looking at.
Okay.
Just out
Yep.
of
But those,
curiosity.
that's one of the, those are a couple little reasons why that there can be those discrepancies. All right. And then the next, out of all those numbers that we're talking about, the facilities in town, you guys, I'm sure are well aware of the fact that we have a good amount of assisted living, long-term care. We've got a couple of recovery centers and stuff. So all these different congregate care facilities, including group homes. It's going through those homes again. Certainly not the caliber that it was last, March back in 2020. I keep forgetting that we're in 2022 here. So not those kinds of numbers, but it's still going through. The good thing is, again, there's not a lot of the hospitalizations. And I know this only because of just speaking with the different facilities. That's one of the questions that I ask is, what's, you have a lot of people going into the hospital. So that's a really big change from 2020 as well, which, obviously the vaccines are what's doing that, keeping that in check. Schools, it's still flying through the schools as well. Daycares, they are getting pretty hard hit as well. So all the little ones are, it's going through all of them. So the number, that 334 number is, a mishmash of all of those different entities. So, school age, long-term care, congregate, as the only other thing that I have on my agenda for COVID updates is there was a DESE call yesterday that we were all on, and they are actually pushing for schools to switch over from the test and stay. Are you guys all familiar with test and stay? Okay, so what they're encouraging schools to do, and the schools can opt in or they can opt out. It is not required, but what they're looking at is going to a home testing option. So instead of doing the test and stay, they would stop doing the test and stay, and students would be going home with test kits, and the families would be testing at home. And then schools would do pool testing versus the test and stay. The only time that they would do the testing at school, aside from pool testing, is if a child was or a staff member were symptomatic, then they would test them. But other than that, they're encouraging the schools to move away from test and stay, contact tracing, and all of that stuff. So a lot of the schools are actually leaning towards that. Danvers is leaning towards that. I don't know if you guys have any comments about that.
Well, the test and stay in many ways didn't make a lot of sense anyway, because if they were symptomatic, they were going to be sent home either way. And the tests they're doing are not very effective at picking up negatives. So, I mean, there's more, I should say there's more false negatives than there is positives.
Correct.
Very inefficient way of doing it. And just adding another layer of inefficiency here, because number one, a person who's swabbing their own nose is not going to be maybe as vigorous as someone else would be. Number two, maybe other pieces of agenda about whether you're reporting a positive or a negative test. Since nobody is seeing this except the family themselves, we don't know for sure what it means.
That we actually brought that up, or that was brought up in that DESE call. And, the state is really moving away from, I think they're just trying to change gears with all of this. They're still, what they're looking at is taking putting the onus on family members and individuals. You know, there's 98 to 99%, they have found children that have been in school. There's the numbers are 99% as far as the, you know, school transmission. There is no school transmission basically. So with all of these kids that are testing positive, it's from home, the community and that stuff. So that's why they're looking at it that way. And, you know, the thing that was brought up was the fear on, you know, public health and school end of it, that, so what happens if, you know, the kids don't test? And Desi said, you know, they can still come to school. They're not going to be kept home. They're going to allow them to come back to school. So there's a lot of loopholes in it, but I think that this is kind of the way the state is going anyway. DPH is, they're getting away from this intense contact tracing and investigation and all of that stuff. And they're going to start treating it more like influenza, where local public health, yes, we acknowledge, yep, but we don't investigate any longer.
Mr. Chairman, just a quick question for Judith on this point. Is DESI moving because of lack of resources, or because in their mind it makes scientific sense to move in that direction? I'm just curious.
I think that there's a little bit of both components there, you know, but I think that it's more so because of the scientific evidence. There's very, very little school spread. And they've seen this, they've known it, and, you know, they've taken the data on it. But it's not just DESI. DPH is truly starting to move. You know, they're telling us, stop, we're not doing contact tracing anymore, you know, unless it's in the household. Our phone calls have gone from 1 hour plus down to 15 minutes to a half an hour, because DPH is starting to cut down on the amount of information that we need to grab at this point. You know, they know how this is spread. They know the course that it's going. So now DPH is even starting to make that move, not quick enough, but they're starting to make the move as well. The EEC for the daycares, they are starting to do the same as far as, you know, sending testing kits home and that type of thing. EEC is even saying at this point, it's not required to test. You know, your child is symptomatic, you keep them home, you know, 5 days. So it's really interesting how they're starting to make that shift, but they're all starting to follow suit. So it's not just DESI.
We're entering the endemic phase of this, I guess.
Yeah.
Correct.
We're entering the endemic phase rather than the pandemic phase.
Yep, most definitely.
Right. Can I say something? Like, I think it's at that point where it's going to be around, and this is just, we have to move it into more like the flu type tracing, because we can't keep this up, what you've been doing for the contact tracing and all of that, right?
I second that.
I think, yeah, we're moving towards, we're all, you know, people are going to get sick from it, but we can cope and move on. I know you mentioned that the hospitalizations were down in like the skilled nursing facilities and whatnot for the folks that are getting it again through those facilities. But I do want to say the hospitalizations that I've seen are still, the hospitals still have a lot of COVID cases.
Oh, they
So
do, most definitely.
Yeah, it's definitely not like, yeah, it's still a drain on the healthcare system right now, for sure.
It is, most definitely. So that's it on my end of it as far as the COVID updates go.
A couple of questions, Judith. The vaccination rate, you said we are about at 76%. How do we compare to the state? Do you have any idea?
Aaron might have those numbers. I don't look at the state numbers. Okay. I pull my report, and so that number is, I start from the age 5 years old up to 110 years old. Not that we have any 110 years old, but so, although I just had a 104-year-old person come through.
Wow.
So I don't know if Aaron's has those numbers, but I do not have the state numbers.
I'm just trying to pull them up while we're talking.
And also, I think it was last week we were at about 16% positivity rate. Not that it matters that much. Do we have any idea where we are today?
Yeah, it's 17.79% this week, and I think it was 17.65 last week. So it's still, I mean, we haven't really moved too much.
I mean, I
That's a
realize
leading
that,
indicator, yeah.
yeah, it's not a big indicator of much anymore as it was before. I remember the days where we wanted to be below 2% positivity rate, and being at 3 or 4% was such a big deal. But I mean, almost 18% is still a huge number.
It is, and the surrounding communities, I can tell you that we're right in line with the surrounding communities. If you want to compare, I think the lowest one was Swampscott, and they were at this is last week, 16% up to Peabody, which was 22%, or Salem was 22%, something like that.
Okay.
I just shared my screen. This is the dashboard as of 5 o'clock today. It doesn't give you a total statewide number, but it's giving you by county.
Look
Okay,
at the islands.
Okay, so that's not bad.
Hey, can you still hear me? Because since you switched over, Aaron, I froze.
Oh, we hear you. Yeah,
As long as
I'll
you can
stop.
hear me.
I'll stop sharing.
I'm not sure if that will work.
We
I
can
can
hear
hear
you.
you.
I couldn't have been smiling when it froze. Thanks a lot.
Drinking
Oh.
lemonade.
Okay.
It'll catch up. I apologize.
Any other questions for me?
I think if I may, Mr. Chair, there's two kind of under COVID-19 updates and relating to really stemming from the mask mandate. Resident of town, Mark Zubrick, and I will forward these to the board after the meeting. Mark Zubrick, a longtime member of town meeting, not currently a town meeting member, but longtime activist here in town, is inviting the board onto his show, Talk of the Town, a cable access, or is extending an invitation to the board. I will pass that forward to you to consider. And we also got an email. We've had a lot of back and forth with a couple of individuals over the last couple of weeks. I also got an email from resident Matt Farley, who has a number of questions or statements, comments on the mask mandate. I want to make sure that you all see that. So I'll make sure those get to you after this. But generally speaking, they're looking for explanations of the mask mandate and why we moved in that direction. I can't speak for the board, so I told them I would pass these on to you all. And if you have responses or something to that effect, I'm happy to kind of coming through me, go back to them. You don't have to respond, but I will pass those forward to you for your consideration.
I mean, I do think that when I'm looking at the numbers, I mean, we are at 334 last week, and or this week it was 428 last week. So we're heading in the right direction. That's a good thing. I believe prior to the mask mandate, we were actually almost at 500. I don't have the exact number here with me, but it was on the minutes of the last meeting. And given that increase, and if you look at November, I believe in November we were less than 300 cases for the whole month. And then all of a sudden we were seeing almost 500 for a week. I mean, there's nothing else. I mean, that was such a big jump that I don't think there was a lot of choice but move on to enact that mandate.
There's two other things that are important. There's two other things that are important. One of them is that I think we have to get away from the idea that there's any real argument about whether masks work or not. They do. I mean, and I think our experience is one more piece of information that shows that. Somebody had thrown up in the last meeting about masks only worked for 11%. I don't know what the exact criteria they were using, but it was only 11% effective. And if you could do the calculations, that means that over the last year and a half, it would be almost 100,000 people that would still be alive if we got even as little as 11% effect of the masks. So this is not nothing. It may not be ideal or a huge number, but it does work and it does prevent disease. Simple as that. And you can cite studies that show it doesn't, as there always is in medicine. Find studies that'll show anything you like, but you have to take the overwhelming evidence, and there's 90 studies that show something different for every one that they can pick up that says that masks don't work.
Yeah, and if I can add to, I want to keep in mind that part of doing any kind of masking and trying to keep the numbers down is to prevent the healthcare system from being overwhelmed. And I can tell you right now that healthcare staff are done. They're not doing well at all at this point. And they were all there for us at the beginning to take care of us. And I think we're now at that point where if we can even prevent 11% of people from getting really sick and ending up in the hospital, that would be enormous to the hospitals in the area, to the hospital staff, and actually to residents as well, because while the hospitals are overwhelmed and having to care for a lot of COVID patients as they are now, it's limiting the access that we might have as residents to get into the hospital. Surgeries, some of the surgeries are put on hold right now. If you need immediate assistance, you're going to be waiting in an ER for a very long time. And I would just hate to ever see that we get to a point, and we've been close, where you have to decide who gets what kind of service and who gets the respirator and who doesn't. So I just want to make sure that we keep that in the back of our minds too, that while our numbers might be decreasing here, I think we need to watch what's going on in the healthcare system around us as well.
If the board wishes, I have Judith's numbers going back to the beginning of September as a graph, if you'd like to see that. And
Please.
Again, I'll just point out where we were at 12/23. That was a Thursday, so we actually had numbers. We were at 224 cases that night. Again, might freeze somebody, but so here's going all the way back to that last week and the last 2 weeks of September. So again, looks like we're trending in the right direction here. Again, a nice drop this week, but nothing like that increase the week you adopted that. I mean, you can see we went over from 224 to 467 cases in 7 days, and quite a big jump. So, okay.
Poor Judith is still frozen.
I am.
I know. Why don't
Maybe
you
should
want to
just let it go?
I'm going to disable your camera and then re-enable it, and maybe we'll get you unfrozen.
Okay.
And then, all right, you might have to turn it on manually to come back in.
Right. Yay!
Hey, there we go.
Sorry, I should have done that sooner. That was not polite of me.
It's all right. Thank you.
I let you hang there.
Yeah.
So Dr. McLaughlin, I think you have your next agenda item is public comments, and then followed by the open meeting law violation. The assuming you want to throw it open to our guests, we appear to have 2 members of the public that may wish to speak. Do we want to invite them to speak if they have comment?
Do either one have their hand up? I don't know.
Well, you'll have to come forward. I can't hear you.
Do either one of them have their hand up?
Not at the moment. Would either of our guests, oh, I do see Ms. Monahan has raised her hand. So I'm going to enable your microphone. You will then have to unmute yourself. And if you can introduce yourself for the record.
Hi there, I'm Caitlin Monahan.
Hi, Caitlin.
Hi. I wanted, I'd heard about some of the feedback that the board was getting about the mask mandate and the violation of the open meeting. And I'm not going to comment on that, but what I did want to comment on was how grateful I am that we did have that mask mandate. And I just wanted to throw out a thank you. As you say, the healthcare system is being bogged down and they're losing stamina. And you know, we started off this pandemic with such love and esteem for these individuals, and it's just turned into the complete opposite, which is so very sad. I am a parent of 3 little boys, one of them under the age of 5 who is not able to be vaccinated. And within his daycare obviously have many kids who cannot be vaccinated at this point. And as the news has come out about Omicron, the data from South Africa showing us that Omicron is 49% worse for children than some of the other variants were, and that the admissions are up 25% in the 4 to 18 range. And I know some of the argument on that is that the data is skewed because of vaccines, but regardless, I don't think it's necessarily something to ignore because we have all these kids under the age of 4 who aren't vaccinated, who are within that group. So I'm really grateful that this is here and hopefully will stay. I take great peace in knowing that there are so many community members out there who are wearing their masks and who are taking care of the people who may not be able to be protected or could get this virus and still get very sick and hospitalized. So I just wanted to thank you for your action. And I just hope that this continues to move forward and everything's able to be evened out. So thank you very much. I really appreciate it.
Thank you, Ms.
Thank you.
Monahan. All right, I'm going to disable the mic.
For the record, that's my daughter. Well, I asked her to speak because I figured that I figured we needed some, support. And I made the comment to Dee after the last meeting. I said, well, we had 18 people who were upset. There's 28,000 people in Danvers, so 18 out of 28,000 isn't bad. But unfortunately, none of the people that weren't upset called in. So I just wanted to get a few voices that were supportive of us. Thank you.
And
I mean, to be candid, Mr. Chairman, I and this is not scientific. Just shopping around town, I went to a store, and I'm not going to disclose which one it was last week. And as I was waiting, there's one person who walked in without a mask, and the cashier said, "Sir, could you please wear your mask?" He apologized, went out, and got his mask. Then a few minutes later, 2 other people walked in, and she said the same thing. One of them was a little hesitant, and the other one pulled him out and said, "Oh, let's go get it. We have it in the car." And they came right back. So I went to her after the transaction, and we spoke for about an hour. And I asked her, the owner, I'm serious, the owner actually came on. I did not ask for their permission to use their names here, and I asked them, what do you think about this mask mandate and how are people taking it? And verbatim, she told me 99% of the people are fine with it. The majority of the people don't have it on when they walked in because they forgot or they overlooked it. But the minute we tell them that they need one, Either they go get it or we offer them one. But then she started telling me the story about someone who came the week before and was very upset and said, you guys are the reason why we lose our freedoms. And so it became a freedom issue instead of a health issue. So so I I think there's a silent majority out there who are really supportive of this. I believe that the science is on our side. And at the end of the day, we are here, as I always say, to protect, prevent, and promote. And I just hope that we do have a buy-in from the public. Public health is not an absolute science. It's not, it's not like it's nuance, right? And we're going through a period where we will loosen up the mask and bring the mask back on, and the buy-in of the public is the only way or the best way to move forward. When we have the mask, if you are the one who has COVID, wearing your mask, the CDC call it the source control. We control it from the source. And the person who doesn't have COVID is the filtration for, the wearer control. So if we get it from both ends, you wear yours, I wear mine, we significantly minimize the possibility of contamination. So I think, thank you, Ms. Monahan. And uh and thanks to everyone out there who is really not only enforcing this, but trying their best to make sure that we get on the other side, which I think we will.
I know Ms. Monahan wants to chime in. I would just say from an enforcement standpoint, there are a couple of businesses that are kind of digging in that this is something they don't want to support. But I think to Mr. DeJoko's point, we have far more calls coming in concerned about compliance than we do complaints. That said, there is probably 3 or 4 places that have made themselves known to us that are not happy about the situation and aren't really doing much about it. But again, to your point, overwhelming compliance, overwhelming support based on the complaints we're getting at the front line.
And I would say, I mean, this may not be scientific as well, but we can only go with the numbers we have. We had 428, and we knew there was going to be a peak after the holidays with everybody getting together and shopping and everything. Well, we are 94 people less than we had last week. We are hoping that next week we have less again. And
Ms. Monahan
are
has
we going to attribute everything to
re-raised
the
her
mask?
hand.
Maybe not, but as long as we're going in that direction, as long as we're going in that direction, I think that's a great thing.
First of all, Mr. Chairman, Dr. McLaughlin, thanks for blowing my cover. The other thing I just wanted to also comment on as someone in the public about the mask mandate is that it does seem overwhelmingly that people are working with it. But I think one thing that a lot of people are not aware of is that there is an enforcement from the side of law enforcement, I believe, of this, that if people aren't being compliant with it. But I think there's also a very huge fear of people who are working, someone who works at Party City doesn't make enough to put themselves in harm's way to enforce a mask policy, and someone who blatantly is ignoring it. So I know that that's a huge concern in the community. And when I had brought up that there was this other, they could call law enforcement if they wanted to, if they had concerns, and they were completely unaware that that was something that could be done. So I hope that there's some communication about how this is being enforced, and or who they should contact in case of concern. But I lost my train of thought on the last thing I was going to say. So I'll just stop there. But anyways, I just wanted to share that from the community, that people. I mean, there was that story today of a man who was for mask mandates, threw a cup of coffee at someone else, and now he's being he was arraigned for assault with a deadly weapon on someone who wasn't wearing a mask. So I mean, there's these very polar stories that people are hearing, and they're afraid to speak up if they see something. So Just want to throw that out there.
Thank you. Okay. Dr. McLaughlin, I think the only other agenda item is the principal reason we're convening off schedule would be to discuss the open meeting law complaint. Would you like me to
Sure,
kind of walk you through that?
sure.
So you've received it all now twice. I sent it to you shortly after it was filed. I think it was technically filed over the weekend of, sorry, I'm just trying to look at the date. I guess it was the weekend before Martin Luther King weekend, it was filed. Under the law, we have the public body of which the open meeting law complaint is filed against has a obligation to meet and discuss the complaint within 14 business days. So we could not wait until the February 6th meeting in order to satisfy that requirement. I shared the open meeting law complaint with you again in the meeting materials earlier this week. As I've expressed anecdotally to you in the emails, I have been in contact with town council's office on this complaint. The complaint itself is a mix of procedural and substantive concerns. The open meeting law is procedural only. And town council is prepared, should the board tonight ask for that help from town council's office, which is our recommendation to draft a response based on that we feel we properly conducted the meeting of 12/23, and that, again, in this case, the alleged the response that the proponent would like is that we invalidate the mask mandate. It's not staff's recommendation or council's recommendation that that be the outcome. We feel that we posted the meeting properly. So the recommendation from staff led by town council is that the board move to delegate the response to the complaint to town council. And I'd ask town council if we could, myself and Dr. McLaughlin, see the letter before it's finalized, just to make sure we know what's going out. But that is our recommendation to you this evening.
Somebody like to make a motion?
I move that we move the response to the open meeting law complaint to town council, and that that is looked at by Aaron and the chair.
I second.
Dee, would you vote for or nay?
Hold on, I think maybe my motion wasn't well stated. Aaron, did I miss something on my motion?
Nope. I just wanted to make sure you do a roll call vote because we are remote. We have to
Okay.
do a roll call.
Just asking, yeah, so Dee, yay or nay?
Yes.
Sheila?
Yes.
I vote yes also. Carries 3-0.
That is unanimous. The next meeting of the board would be February 6th. I suppose if do you feel it necessary to meet between now and then? We would obviously update you with the numbers next Thursday. But we'll take your lead if you want to wait 2 weeks for your next meeting.
I think that's reasonable.
I think that's fine.
Judith, what was that signal?
Did you say February 6th?
I'm sorry,
It's-
the
it would
3rd.
be February
I said
3.
Let's not meet the 6th.
It's a
I
Sunday.
think that's Super Bowl Sunday. That would
Yes, I won't
That
be
would be
here.
not good.
Next one.
right. But obviously, if the numbers, if anyone sees the numbers and feels we should convene, let us know. The new public health director starts Monday morning, so you
Oh.
might not see me again, hopefully.
Great.
Although again, it's been a pleasure helping you through this transition, and I appreciate the patience. I know it's been a lot and much. I've actually enjoyed working with you all very much. And if you need anything, please let me know. Otherwise, hopefully at your next meeting on the 3rd, you'll be in the hands of an expert.
Erin, you've been great. Thank
Yes,
you.
absolutely. No,
I think you've done a fabulous job.
18 years later, I should have learned something.
different things.
Thank you.
And I concur. With Sheila, not with you, Aaron.
And Mr. Chairman, before we adjourn, I think that's where we're heading, right?
Yes.
Just want to let the residents know, and maybe, I don't know, Aaron, if we can put that like on the town website. There's a possibility of residents to order free home COVID tests. Do we have that
It's-
on our
We
website?
pushed it out on social media.
Okay.
So we have been pushing that out.
Okay, perfect. Yes.
And we're
It's
trying to order some more additional test kits. It's availability and it's a bit like trying to capture lightning. But we are making efforts as a community to try to ascertain additional at-home tests.
the process is very easy. I did order one. It was less than 5 minutes, and you place your order. So I'll encourage everyone to order those. And also, while I was talking to this business owner in town, one of the things that they said was there's some people who may not have access to social media, and now that we don't necessarily have our town newspaper, the Danvers Herald, I don't know what it's called these days. He was asking about, actually because they were all there. They were asking about some kind of 911 reverse call or some kind of robocalls if we have pertinent health information to send out to the public.
School
So I
department does that quite regularly, yeah.
yes, they do that at the school department, and they were saying that when we did the mask mandate, they would have loved to enforce it at midnight as we had stated, but they didn't find out until someone came and told them, well, are you guys not wearing the mask? And he's like, what do you mean? He's like, well, there's a mandate. And then they went on this website and they saw it on the town website, but they were suggesting to me that for something this time sensitive and urgent, if we have a different way of communicating with the public than just the social media, it could be a good thing. And they suggested I don't know what it's called, 911 reverse call, something like that. Just
And
food for thought.
It's something, again, a different division of our department is been working on, and it's almost embarrassing to talk about it, but we don't have a master list for businesses. So that's something we're trying to develop. The way business permitting works, it's kind of like some businesses are in the building office, some are in the town clerk's office, some are here, and we're trying to pull all of those data sources together to have one list to much more easily than we've been able to reach everybody. Back in the day, Mark Carleo and I literally were going through the phone book with our business list, calling the businesses to make sure they knew what was what. We just don't have the bandwidth to do that at the moment, but so we're trying to make those improvements as we go. But yeah, the reverse 911 call, I wrote that down. That's a great idea. We did talk about that, and I don't believe we did that call, but that's a great idea. And I'll double back with the town manager's office regarding the test kits to make sure that we kind of reach everybody that might not have social media.
Exactly. And that could go not only to businesses, but to residents as well.
Yeah,
Just
exactly.
say, okay, you have the possibility of ordering these kits. If you don't have social media, you can still get the information.
Yeah. Yep.
Right, so we ready to adjourn?
I move that we adjourn.
Second.
Right, so Dee, do you vote
Yes.
Yes.
I vote yes also, so we're.
Thank you.
Are we officially offline now, so to speak? No,
Nope.
because I have something I wanted to talk to you, Aaron, that is,
I can kick everybody off and leave you on.
Okay.
Okay. I'll kick everybody else out, or if you don't leave, I'll,
Well, the board is fine. I just didn't want the public is the ones that I just didn't.
Yep.
want to-
let me, thank you all. All right. Try to get how to see if I can.
Are we all set?
Yep, I think we're all set. We are adjourned.
Okay.
All right.
I can go to the high school now for my daughter's concert.
Get there,
Yes.
get there.
Oh, yay, enjoy.
Awesome.
Thank you.
All right.
Bye.
Bye.
Aye.
Okay.
Well, I mean, I